My name is Carlo Ercoli. I am a prosthodontist and a periodontist, and I am the chairman of the prosthodontic department at the Eastman Institute for Oral Health at the University of Rochester. Eastman Dental is part of the University of Rochester. At the Eastman Dental Center, your care will be provided by dental residents who are dentists who have graduated from dental school, and they are currently enrolled and seeking additional advanced certification and specialization in the field of prosthodontics and periodontics. A dental resident is no different than a physician who has then enrolled in additional and advanced training like a physician could do in orthopedic surgery, neurosurgery, or any other specialty in the medical field. So an implant can be used to replace a single tooth, or we can use it for larger reconstruction, like a full arch bridge, a small makeover. And also in situations where perhaps you're wearing a denture and you're not satisfied with the stability and comfort, one implant or a few implants can go a long way to stabilize that denture and make your comfort and your function much better. A patient might ask themselves, what am I going to face during a dental implant surgery? And I know that it might sound quite invasive, but actually it is not. We often do this just with a simple Novocaine injection, and the surgery itself is relatively straightforward. It involves peeling your gum just a little bit off the underlying bone and drilling in a completely painless way a calibrated hole where the implant is then placed. Once the implant is placed, the bone will heal around the implant much the same way that the broken leg or a broken arm heal and the two pieces of bone will fuse back together. The tooth will effectively feel like your own tooth. Dental implant surgery, contrary to what you might think, does not actually hurt. Once the Novocaine has been given, the only thing that you will feel is actually vibration, pressure, and water, but no pain is actually perceived or felt by the patient. More often than not, we can actually place a temporary crown or a temporary bridge on your implants, and we can do that within the same appointment, within the same day. So you come in perhaps with a tooth that needs to be pulled. We can place your implant and we can place that temporary crown before you go home in such a way that you are the most comfortable and certainly your aesthetics is preserved. After we have designed a treatment plan that addresses your goal and objective, we will sit down with you and understand better how this fits within your financial comfort zone, and also work with you to design payment plans or payment options that are specific for you. The treatment that we provide at Eastman Dental is generally 30 to 50% more affordable than it can be in a comparable specialty practice. And one of the main reasons why we are able to do that is that we are a non-for-profit teaching institution that has served the community for more than 100 years. With dental implant treatment, we don't just replace your own teeth, but we aim to improve your quality of life and really to change lives for the better.